Panamanians are paying a high price for having relaxed strict confinement measures that until 3 weeks ago seemed to have coronavirus infections under relative control. Now the infection rate in the small Central American country of just over 4 million people has become the highest per capita in all of Latin America. Hospitals are on the verge of collapse.
1,000 cases per day means that in the next few weeks we will have about 30 to 40 intensive admissions per day. On a sustained basis, there is no hospital that can sustain such a number of patients.
There are around 44,000 infections and more than 860 deaths in Panama, a huge number for such a small country. By comparison, neighboring Costa Rica, with a similar population, has fewer than 7,000 cases and less than 30 deaths. Panama, whose famous canal joins the Atlantic and Pacific Oceans, prides itself as a country open to the world. But residents can now barely leave their homes in Panama province, which includes the capital. Under new lockdown rules, men and women can go out on alternate days for just 2 hours. A curfew is in place from 7 p.m. to 5 a.m. and all day and night on Sundays. Yet the curve of infections continues on its vertical rise.
I've been queuing for 2 hours waiting to be tested, but the queue is too long and the sun is really strong. That's why I'm like this with my coat over my head. The sun is intense and I'm really not feeling well.
The president has replaced the health minister, but doctors say that's not enough. They're urging the government to impose a nationwide lockdown immediately before the infections spread to every corner of the country, including remote indigenous communities where health services are even less equipped to save lives. Lucia, Newman, Al Jazeera.